Hi, I'm Dr. Matt Swenson. Because September is National Suicide Prevention Month, I want to take a moment to try to convince you that you can do more than you think to help people with depression or suicidal ideation. And it starts with creating emotional safety. This is the kind of safety that allows for people to accept their own feelings and failings, open up to others, or consider new ways of approaching life. Safe to talk, safe to feel, safe to fail, safe to explore, safe to be themselves. Experts agree that these critical needs are too often overlooked, and it's also true that the people who are best positioned to support these emotional needs are usually not experts like myself, but are actually friends, teachers, family members, neighbors, co-workers, people like you. Imagine that you notice a person in your life who seems a little off. They're unusually sensitive, isolative, less expressive, just not themselves. And maybe he or she confides in you that they are really struggling right now and admits to some degree of suicidal thinking. Maybe they just say something like, I just keep thinking that everyone would be better off without me. If you're like most people, you might respond in one of three ways. One, you might try to talk some sense into them. Of course people care about you. You're an incredible person. Nobody would be better off without you. Quit selling yourself short. Unfortunately, this can come across as invalidating the person's thoughts or feelings, and they may even feel worse, either not listened to or not understood. Two, you might try to fix the problem, give advice about things they could try to help themselves feel better. Let's do something this weekend, or why don't you read this book that's been helpful to me? The problem with this approach is that people don't want to be fixed. Particularly people with depression, anxiety, they already feel broken in some way. They already feel like they're a burden on other people. And if you jump in to try to fix, guess what you've done? You've inadvertently reinforced that they are broken and need to be fixed, and that you're the one that has to do it. So let's be careful about fix it. Three, you might quickly pass them off to someone else, maybe a quick referral to a counselor, a call to the suicide hotline, or maybe even a ride in an ambulance to a local emergency room because you're scared. That person is not likely to talk to you the next time. This is especially tragic because if you were the person that they chose to talk to about something so sensitive, so shameful to them, you may have been the best person to make them feel safe, safe to feel, safe to fail, safe to talk. So what would be helpful? Make talking safe by just listening. Make feeling those big emotions safe by resisting your urge to fix them. In other words, your job is not to take them away. You don't take away a person's depression. You don't take away their suicidal thinking. Your job is to understand the feelings and let those feelings be okay. Make it safe to talk and to feel by continuing to ask questions that communicate that we can hear and tolerate these scary and difficult things. Then I use Maslow's hierarchy as my guide, and I consider, now that it's safe, how do I connect? You could say things like, knowing this about you and what you're going through actually makes me feel closer to you or to admire you more. You could build their confidence by saying things like, so what do you think we should do? Or how can I help? Or maybe simply, you can do this. In that moment, you may collaboratively decide that it makes sense to get professional help, to call an ambulance even, or the suicide hotline. I hope you'll do that if you need to. But let's not miss the opportunity before that to really make meaningful strides towards suicide prevention by addressing the emotional needs in addition to those physical needs.